I preferably consider, when I do my revision rhinoplasty, the rib cartilages when I have very complex cases, because it allows me to get a specific amount of cartilage to be grafted onto the nose. If there are smaller defects or smaller corrections, I can go to the nasal septum cartilage if it's available, or if there is a chance to reconstruct the nasal tip, I go to the ear cartilage.
If I need very strong or very much cartilage, then I would choose rib. If I need some soft cartilage, stability is not the main question, then ear may be fine. And otherwise, if I need just small pieces, septum will be fine. But as your question concerned revision cases, it's always wise in revision cases to anticipate to have very little or even none septal cartilage left. So the answer would be rib or ear.
Available septum if I still have it, and usually it's not. My practice is rhinoplasty, only 50% about revision, probably edging to 60 now. And in 80% or even more of my revisions, I use rib. I do not use ear cartilage.
For sure, rib cartilage is the best. But there is always the problem, harvesting rib cartilage, everybody is concerned about pneumothorax. And therefore, I think it is important to have the right technique of harvesting a rib. But rib harvesting is really not the big issue. And I think rib cartilage is just perfect. I myself developed a device where you can get strips from 4 different sizes and thicknesses. And I think it's very difficult to sculpture the strips by hand. Therefore, I developed this device where you can get strips of 0.5, 1, 1.5 and 2 millimeters. And this is very helpful. In some cases, like a spreader graft, you need in a male a different size than in a female, but let's say 1 millimeter. But if you do what I do quite often, a total anatomical reconstruction of the lower framework, then of course you need cartilage which is much thinner. And quite often these are revision cases where you cannot go to the septum. The septum of course would be easier to bend, but it works also with rib cartilage. So rib cartilage is no question is the best material. It is the easiest, and you are not limited by the volume.